I welcome you to this particular hour, a time when we talk about our health and ensure that our health is given priority as we take our health to the pinnacle. I'm Willy, Kamya Bujimbi, the Director, EDUCURVE Health and Management Sciences Institute, Mukono, currently offering exceptional health care training and embracing technology in the development and evolution of our healthcare systems in this country. Today, we want to talk about the unique, commonly occurring symptom, pain, and how an intentional, well-trained healthcare provider and a patient in search of healing and cure can utilize pain to be able to reach a goal that can lead to cure, healing, and also improved quality of life. Before I go on, I want to remind you that EDUCURVE Health Sciences Institute has courses at diploma level, diploma in clinical medicine and community health. There, we focus on grooming, preparing a professional who will be able to conduct risk appraisal or risk assessment for disease conditions, be able to assess or examine, interrogate the history of the patient, examine physically, recommend laboratory examinations, and come up with a diagnosis that can be able to help the patient recover when appropriate treatment or management is deployed. Our health professional, that cadre of clinical officers, are prepared not only to deal with the disease, but to deal with the individual in terms of empowering the individual to understand their condition. What caused them to be where they are? What they can do to improve their situation and be able to live a life free from the current disease, but also prevent future attacks. Such a cadre is what we have lacked. We need people who are interested in the health of people, ensuring that they can come less regularly to seek medical care, but instead be partners in promoting healthful living. That cadre also has a role in ensuring that this symptom, pain, is actually utilized to make lives better. Talking about pain, it's a common occurrence. But usually when you ask people what it is, they can fail most of the time. People fail to explain it. But they know it, and they will tell you they've ever experienced it. Because it's the commonly occurring symptom among almost 99% of healthcare seeking people. Except those who go for general examination to say, I just want to find out what is happening to me. Other than those, most people are caused to seek health care because of this symptom, pain. Therefore, pain is what hurts. It might be due to actual damage caused by the disease itself, or injury, or the effect of the disease on other tissues, like the nervous system, or failure or damage, potential damage to such tissues, and the person starts experiencing pain. And therefore, because it is the patient who experiences this pain. We want to empower the patient through this session to understand pain and be able to explain it, how it occurs, its patterns, what makes it worse, where does it start? Is it starting from some point and moves to another, which we call radiating pain? And the well-trained health providers usually take time to interrogate, to assess, to ask questions. In my practice, I've found some patients are not comfortable when the practitioners, the health practitioners, are asking many questions. They are asking them, for example, when did this pain begin? Where is this pain? How does it pain you? And this is where sometimes clients find it hard to explain how this pain actually looks like. I have good news for you. There is no pain that is experienced by people in the same way. Therefore, you are just being called upon to explain how this pain is occurring and how exactly you feel it, because the medical practitioner is linking what you are saying with what is known and will be able to be guided to the right diagnosis. Therefore, withholding information about pain or giving less information or inaccurate information about pain as a patient is simply leading you to a place of wrong diagnosis, wrong treatment, and delayed healing, and compromised or reduced quality of life. In healthcare, we want to ensure that the health provider works with the client and the caregivers of family to ensure that everything is done to make the right diagnosis, administer the right treatment, administer the right treatment rightly, and secure early recovery, minimal effects, and improved quality of life. Building a contributor who will do that cannot be easily achieved anywhere. That's why at EDUCURVE we ensure that whenever we are preparing a professional, they are more hands-on, they are used to solving clients' problems, both in a healthcare setting, in a community setting, at home, and even in gatherings where people are quite many, so that they are equipped with techniques and tactics of exploring and getting information, accurate information from clients, whether children or adults, to be able to help them. Therefore, this issue of pain as a symptom is a critical contributor to our recovery, where we have the patient at the center and the care team around them.